diabetic ketoacidosis, the name has three components or three parts: diabetic ketoacidosis. And this shows or manifests three characteristic features of this disease, diabetic ketoacidosis. Diabetic, because this is a acute complication of diabetes mellitus, which presents with very high blood glucose level. So there's a feature of hyperglycaemia. So that's why it is diabetic, because diabetes is characterized by hyperglycemia, high blood sugar level. Also in this disorder we get ketonemia, because excess ketone body production in the blood, presence in the blood. So diabetic keto. And acidosis, because this disorder is basically characterized by a high anion gap metabolic acidosis. So as you see the name, diabetic ketoacidosis, it's basically a part of a triad: hyperglycemia, typically more than 250 mg per dl; keto, because there is a presence of ketone body, excess ketone body. Why it happens, I would explain shortly. And acidosis, because there is a metabolic acidosis happens in this disorder. Now, the thing is that this disorder is typically seen when there is a severe deficiency of insulin. More commonly would be seen if there is an absolute deficiency of the insulin states. Now, what happens when there is a severe deficiency of the insulin? A particular enzyme gets activated. The name of that enzyme is hormone sensitive lipase. From the name you get a hint that this, what does it do? It is hormone sensitive lipase. It is hormone sensitive because it is sensitive to a hormone like insulin. And normally insulin inhibits it. And what does it do? It do degradation of lipase. So when there is very severe deficiency of the insulin, what happens? Hormone sensitive lipase, which is normally inhibited by the insulin, it gets overactivated. And it starts to degrade the peripheral storage of the fatty tissue, adipose tissue. So what would happen? This hormone sensitive lipase would act on the fatty tissue, and they would convert the fatty adipose tissue into free fatty acid and glycerol. And now there would be excess free fatty acid production, FFA. That excess free fatty acid, they would now come into the liver. And the liver, what is going to happen? As this is a state where there is a insulin is very low and relatively glucagon is high, so insulin glucagon ratio is in favor of the glucagon. What is going to happen? That in this disorder, these all free fatty acid would be converted into ketone bodies, and that's why you'll be getting ketonemia. Ketonemia, emia, something ending with emia means in the blood. So ketonemia means excess ketone bodies in the blood. Now, what are those ketone bodies which are produced? They contain products like acetic acid, beta hydroxybutyric acid. So these things would be now neutralized by bicarbonate. So bicarbonate level would fall, and as these acids are produced, so there will be metabolic acidosis there, particularly high anion gap metabolic acidosis. I would explain it in a separate session, because there are many causes of high anion gap metabolic acidosis. Diabetic ketoacidosis is just one of them. So anion gap is typically more than 10 milliequivalent per liter. Now in this disorder, so we are getting, there are three components. There is a hyperglycemia, very high blood glucose level, more than 250 mg per dl. We get ketonemia. As these ketone bodies are, to neutralize them, acids actually, beta hydroxybutyric acid, acetic acid, to neutralize them, the level of bicarbonate would fall. So bicarbonate level would be typically not more than 18 milliequivalent per liter. It should be less than or up to 18 milliequivalent per liter in this condition. If it is more than 18 milliequivalent per liter, it's not diagnostic for, it's not seen in this thing. Because what is happening in this condition, that bicarbonates are getting utilized to neutralize those acids. And also what we are getting this high anion gap metabolic acidosis. So now another thing needed to explain here, that why we get very high blood glucose level in this condition. So as I mentioned, this disorder is characterized by severe deficiency of the insulin. When you have severe deficiency of insulin, then only you produce diabetic ketoacidosis. Particularly is more seen in absolute deficiency of the insulin. And what happens in that absolute deficiency of the insulin state, that also some other things start to happen. Because normally what insulin does, insulin job is to, whatever food you are taking in the form of glucose, when it's converted to glucose, they want to store that glucose, that cash, into some form which you have converted, can be converted, again converted back into glucose later. It's like, imagine you have won a lottery, you have a lot of cash right now. If you go to an investment banker like insulin, what they would do, they would convert some cash into real estate, convert some cash into mutual fund or gold or some other things which you can later encash to get cash again. So similarly, what they are doing, if the insulin is not there, what would happen? Whatever glucose you eat is there, if you cannot utilize it, it will be flushed away by urine. But that is not happening. Why? Because insulin is converting that glucose. It is doing peripheral utilization of the glucose in the peripheral tissues like adipose tissue, skeletal muscle. It is converting into glycogen. It is preventing new glucose formation because you already have too much glucose. So it prevents gluconeogenesis, insulin normally. It prevents glycogenolysis. It supports glycogenesis, all these things. So its ultimate aim is to convert the glucose into some storage form. You can think like that as a power bank kind of thing, that they are storing that power in that power bank in some body's tissues so that you can utilize that glucose if it is required tomorrow. Even if you're not eating your breakfast or lunch for a while, you would survive it because some of that thing would be converted back into the glucose, the storage form. That is the job is like insulin. So when insulin is not there, what is going to happen in the body in decay? This explains why you get high blood glucose level in the decay, because what is going to happen that your peripheral utilization of the glucose would not occur because insulin is not there, severely deficient state of insulin. There would be excess gluconeogenesis can occur because insulin is normally prevents gluconeogenesis. Glycogenolysis can occur because glycogen will be again converted back into the glucose, and because insulin normally supports glycogen synthesis and prevents glycogen degradation. So ultimately what is going to happen, your blood glucose level is going to be high when you have severely deficient insulin state. So that's why you get hyperglycemia, very high blood glucose level in a state of decay, because the main problem here is severe insulin deficiency, particularly more commonly seen in absolute insulin deficiency. I would make a different video to explain this, that why ketonemia is only seen in diabetic ketoacidosis but not seen in hyperosmolar hyperglycemic state, which is another metabolic complication of the diabetes mellitus. But in this video, what we discussed, that what is diabetic ketoacidosis? It's an acute complication of diabetes mellitus, because we know that complication of diabetes mellitus could be acute, could be chronic. Chronic, like diabetic retinopathy, diabetic neuropathy, diabetic nephropathy, these are all chronic complications. But this is a different kind of complication, diabetic ketoacidosis. This is happening suddenly, acutely, characterized by sudden blood glucose level rise, more than 250 mg per dl typically. And there would be the presence of ketonemia, metabolic acidosis, high anion gap metabolic acidosis. And why they would happen, I already mentioned. Ketone body production is definitely because due to severe insulin deficiency, hormone sensitive lipase, that enzyme would be activated, which would cause degradation of the excess lipid from the body, fat storage of the body, which would make more free fatty acid, which would be converted in the liver into excess ketone bodies. That's why it would be ketonemia. Ketone bodies are mostly acids, beta hydroxybutyric acid, acetic acid. So that's why you'll be getting metabolic acidosis, because to neutralize them, bicarbonate level would be, bicarbonates would be utilized and bicarbonate level would be decreasing or falling, and they would be typically fall below 18 in these patients. And we also get these patients that high anion gap metabolic acidosis. So in the next session, I think this is the first one. The next session I would explain that some important features of the decay, like why decay is associated with ketonemia, but other acute metabolic complication of diabetes mellitus, which is hyperosmolar hyperglycemic state, we don't get ketone body production. Thank you so much.